Thank you for the opportunity to present today. The work we're presenting here is the systemic effects associated with Cobalt-Chrome total hip replacement implants using NJR data. These are our disclosures. So, systemic effects from hip replacement implants have been studied over a number of years, and currently there is no cause for concern until 2018, when the French national database study was published of 250,000 patients, which showed an increased risk of dilated cardiomyopathy and heart failure with metal hip replacement heads. The authors suggested that this was due to Cobalt-Chrome release and recommended regular cardiac monitoring in these patients. But a limitation of the work was that they focused on the head material, namely whether it was metal or ceramic, and not the stem material, which is an important contributing factor. But if the association in the French study is causal, this is a major public health issue because over 2 million patients a year have hip replacements worldwide. So our study aims were to determine whether Cobalt-Chrome containing hip replacements were associated with an increased risk of all-cause mortality, heart outcomes, cancer, and neurodegenerative disorders. So this was a retrospective NJR-based study looking at elective hip replacements for osteoarthritis with HES-linked data. We excluded patients with bilateral hip replacements, anybody with a total knee replacement, and anybody who had the outcome of interest preoperatively. The exposure variable was binary, namely whether a patient had a Cobalt-Chrome or non-Cobalt-Chrome containing implant, and for this we included the composition of the head and the stem material. Outcomes of interest were defined previously, and we got these using standard ICD-10 codes. And we used adjusted flexible parametric survival models for our analysis. So there were 375,000 primary hip replacements with up to 15 years maximum follow-up. There were 35% of the hip replacements with Cobalt-Chrome containing implants, and the remainder had non-Cobalt-Chrome containing implants. The proportion having the outcomes of interest in the cohort as a whole are shown here, with 15% having all-cause mortality. So when we look at all-cause mortality, there was no difference between the Cobalt-Chrome and the non-Cobalt-Chrome implants in the adjusted analysis. And we found the same when we did sub-analyses specifically for heart-related mortality, cancer-related mortality, and neuro-related mortality. For incident heart outcomes, there was no difference between the Cobalt-Chrome and the non-Cobalt-Chrome containing hip implants. And we found the same when we did sub-analyses for heart failure, cardiomyopathy, and other similar analyses for other heart endpoints. For cancer outcomes, there was no difference between Cobalt-Chrome and non-Cobalt-Chrome containing implants. And again, it was the same results when we looked at specific cancers such as lung and hematological. For neurodegenerative outcomes, we found no statistically significant difference between Cobalt-Chrome and non-Cobalt-Chrome implants, and it was the same when we looked at the sub-analyses specifically for dementia, Alzheimer's, and Parkinson's disease. However, a caveat here is that, as you'll see at 11 years, the two lines, although non-significant, appear to be diverging with a trend towards Cobalt-Chrome containing implants having increased risk of neurodegenerative outcomes. But the confidence intervals here are wide, and this could be a chance finding. So in conclusion, data from the world's largest joint replacement registry has shown that Cobalt-Chrome containing hip replacements are not associated with an increased risk of all-cause mortality, heart outcomes, cancer, and neurodegenerative disorders with a follow-up time available. Our findings will help reassure clinicians and patients that primary hip replacement is safe and not associated with systemic implant effects at this time. However, further follow-up is needed to exclude any adverse risk in the longer term, especially with regards to neurodegenerative disorders. Thank you for your time, and I'd just like to acknowledge our funders and also the National Joint Registry.